Hello, welcome to my channel. My name is Augustine Japon, a final year student in the University of Health and Allied Sciences offering biochemistry and molecular biology. Join me as we dive deep into how infections contribute to cancers in Ghana. In Ghana, cancers that mostly occur in our society is liver cancer, prostate cancer, cervical cancer, and also breast cancer. As we go on in life, we realize that several factors contribute to the formation of these forms of cancers. But today, we are going to only talk about how infections also contribute to this cancer formation and how we can prevent them. Okay, so the first cancer we are looking at is cervical cancer. Cervical cancer is a type of cancer that affects the cervix of the female reproductive system. It rates about 13% of the cases of cancer in our females. Now, how does this cancer comes about? There are multiple factors that can result in cervical cancer formation, but human papilloma viral infection also contributes to cervical cancer formation. This viral infection is as a result of sexually transmitted diseases that are brought about by multiple partners or multiple sex partners. It is good that you always go for checkup as a female because chronic infection that results in this particular infection can lead you to having this cervical cancer. The next cancer we are looking at is liver cancer. Liver cancer takes the lead in the multiple cancers that are in Ghana or affecting our people in Ghana. It takes about 20% of the cancers that are resulted in death in Ghana. Volta region has been recorded to have the higher cases of liver cancer, which has been shown to be caused by aflatoxins and also the infections we are looking at, which is hepatitis. Hepatitis infection always affects the liver. Now, hepatitis B or C infections, when it becomes chronic or when left untreated, leads to the formation of cancer cells in the liver. This can cause you to also have a damaged liver. The liver is the most crucial organ in the human body. In most of the cases, it performs the relevant function. So it is also very relevant that you go to the hospital when you have infections that result you to having hepatitis. Thankfully, we have hepatitis B vaccines that you can take, but hepatitis C vaccines are still in the process of being developed. So the next cancer we are looking at is breast cancer and prostate cancer. Although there is no direct relation between how infections occur and how you get breast cancer or prostate cancer. Men are prone to prostate cancer, women are prone to breast cancer. The causes of these cancers can be numerous. It can be inheritable. It can also be based on having some environmental factors, maybe radiation or any of that sort. But since there is no direct relation to this cancer in terms of infection, does not mean infection do not contribute to this. When someone has chronic infections that causes chronic inflammation, can result in also having these types of cancers. Now, someone having HIV is prone to having a lot of cancers. For example, having an HIV become immunocompromised and therefore any cancer at all has the ability of affecting you. So, as the rate at which these cancers are increasing in Ghana, I will entreat you that everything that goes on in your body, whether anything that seems not to be normal or a disease that is trying to form, visit the hospital for you to be checked. Because any of these infections can lead to cancer formation. Now, you should also know that something called Helicobacter pylori, which causes ulcers in the stomach, can also lead to cancer. So cancer can be formed by any infection that occurs in your body. So treating yourself to prevent these cancers from becoming chronic is very, very important. Cancers are not easily prevented, but the factors that lead to cancer formation can easily be prevented. Let's try to transfer this knowledge from one person to the other by sharing this video and subscribing, because having the knowledge of that disease brings about effective prevention measures that we can take. Thank you.